Hello everyone, it's Dr. Sam. I'd like to welcome you to my EyeClarity Podcast. This is a show that offers cutting-edge information on how to improve your vision and overall wellness through holistic methods. I so appreciate you spending part of your day with me. If you have questions, you can send them to hello@drsambyrne.com. Now, to the latest EyeClarity episode. Hello, everybody. It's Dr. Sam, and I'd like to welcome you to another EyeClarity podcast. Today, I'm going to talk about retinal detachment, and I bring this up because one of the students in my 6-week intensive has been dealing with post-surgery of a retinal detachment. In fact, she had 2 surgeries, and I went over what can be done after you have had the surgery. And let me make no mistake about it. You definitely need surgery if your retina detaches. Now, what causes retinal detachment? As I get this question a lot, and there are a variety of factors. I think one of the factors is being nearsighted. And so if you're moderately to high nearsighted, have a nearsighted prescription, I would say anything over -4, you're going to have a higher risk of developing retinal detachment, because what happens in a retinal detachment is as the eyeball changes its shape, it can start to cause the retina to thin. And if the retina is already weak, and I'll talk about reasons why the retina may be weak, then you're definitely more at risk for developing some kind of retinal hole, retinal detachment. In addition, I also feel that if you've had head trauma, if you're under a lot of visual stress, if you suffer systemic inflammation, these are some of the reasons why the retina comes away from the rest of the eyeball. In my practice, one of the biggest reasons I see a retinal detachment has to do with a fluid buildup behind the eye. And this has to do with conditions like wet macular degeneration or retinopathies like diabetic retinopathy or hypertensive retinopathy. Whenever you start getting a fluid buildup behind the retina, you definitely are more at risk for a part of the retina to break away or, in terms of traction, pull away. And if that were to happen, you will start to see flashes of light. You might start to see a curtain come over your eye. And that is a sight-threatening condition. You want to get yourself to the nearest local ophthalmologist and get it put back. And there are a lot of different ways now that surgeries are done. You're going to need to go through a post-operative period of rest. And once you get through all of the surgical procedures and all of those situations, my recommendation, and it's what I told this student of mine, it's really important that you are taking the carotenoids, lutein, zeaxanthin, and astaxanthin. I talk about these a lot. These are the carotenoids that are pigments that protect not only the macula, but also the retina. The 2 plant carotenoids, lutein and zeaxanthin, you can get those from your rainbow vegetables. And the astaxanthin is a marine carotenoid, so you're going to either have to get that through seafood, especially the pink seafood like salmon or shrimp. And if you don't want to go that route, you can do microalgae astaxanthin supplements. Omega-3 fatty acids. There's so many of my patients, I'll say, well, are you taking regular omega-3s? And they say, no, well, yeah, and so they do it for a while and they stop. But make no mistake about it, omega-3s are so important. We don't produce those in our body. So the DHA and the EPA part of the omega-3 is so important for a variety of different conditions: dry eye, glaucoma, cataracts. So in terms of prevention, Also, omega-3 is so important for brain health, our nervous system, and it acts as such a strong anti-inflammatory agent. You have to consider omega-3s. I also think things like vitamin C, bilberry, ginkgo, trans-resveratrol, saffron, curcumin, these are all things that either you want to include in your diet or through supplementation. Again, you want to really boost the antioxidants. The retina has one of the highest metabolic needs of the body. And for most people, they're in a starvation state in their eyeballs. And that's part of why the tissue breaks down and why we get all these, eye conditions and eye diseases, because we're just living in a starvation state and a dehydration state. So including these, they help improve circulation, they boost antioxidants, and it's just a no-brainer. You have to take better care of your diet and nutrition. Wearing blue blocking glasses or getting a blue blocking shield is so important, and if you don't do that, it really dries out the retina. And if you do wear a prescription, you need to be careful. Are you using a single vision lens, a progressive lens? Again, I don't feel using a progressive lens is the right optical system. If you're doing hours of screen time, you're better off using a single vision lens. And my eye exercises. I have seen time and time again when people start doing my eye exercises regularly, their eyes are moisture, they're more moist, they're seeing more clearly, they have less tension and stress. So it's really important to do these eye exercises. If you think about how much time we're on the screens and we're focused at one distance for long periods of time, we need to move and use our eyes in a variety of different ways. And when we do that, we create more flexibility and versatility in the eye-brain connection. So retinal detachment is a scary syndrome. It's a scary disease that can occur. Again, you can be proactive by, nutritionally taking better care of yourself, reducing your visual stress, doing my eye exercises, being conscious of the kind of lens prescription you might be wearing. And if it does happen, there are things that you can do afterwards to reduce the aftershock so it doesn't happen again. So that's our show for today. I want to thank you so much for tuning in. Until next time, take care. Thank you for listening. I hope you learned something from the EyeClarity Podcast show today. If you enjoyed the episode, make sure to subscribe on iTunes or Spotify and leave a review. See you here next time.